I'm going to offer a little bit of a different perspective. I think that certainly there's a global dimension to this. Certainly there's a dimension of that should all be thrilled about, the pace at which we managed to, as a global community, kind of work out how to get to these vaccines in multiple different countries, multiple different parts of the world. And I think very interestingly, how the different relationships of different countries have led to the distribution of different vaccines, but vaccines that we all have fairly good confidence about. So I think that in a sense that we saw a world that is kind of organized according to different powered structures, but those power structures have allowed people to have different vaccines, but still have vaccines. I think that you've both described some of the legal issues, some of the trade issues, some of the issues that emerge in terms of how global bodies need to be working together. And I think in most cases, we can report that there's progress on all of these things. And in most cases, we can say that, Pfizer is negotiating with people to be able to have these vaccines produced in other places at lower costs. And these things, some of these agreements took a long time with respect to things like AIDS drugs, right? They took much longer than this. So we've done well. My area of work and my biggest concern is, okay, so if we manage to get these procured, if we manage to get these procured at prices that are acceptable or accessible, if we manage to get them onto ships, what happens? How do we get them from the ports to the patients? How do we do that? My biggest concern here is that we've been talking about the global system, and I think that the global system has responded well, not always cleanly or neatly or easily, but I think that kind of it's responded well. What about the country systems in the countries that are most affected? And I think this gets to where Tabani ended up, that, what we've actually seen is that a lot of countries where you've had great progress in vaccination in the last 15 to 20 years, you get to see that the systems are not as resilient as we'd like them to be. And that actually the kind of vaccination progress we've had with other vaccinations has kind of fallen off during this period of time. And I think that needs to be something that is a lesson to us. People have spoken for a long time about, delivering health services versus building health systems in developing countries. And I think people have said, we'll get to that, we'll get to that, we'll get to that. Well, we need to get to that. It's really, really important. What are the things that we need to focus on? I think global logistics are going to be a problem. We have global logistics problems with regards to everything right now, and getting some of these things just on those ships to the ports, I think that's going to be a lot harder than what we think. But then when we do get to the ports, I think that we need to really be working on logistics in these countries, where this issue of equity is the biggest concern. Because we don't want it just to get to the port. We don't want it just to get to the capital city. We want it to get to the countryside. And this is not just something that's a problem with medicines and vaccines. It's a problem with everything. So we have a gigantic opportunity here to really say, for now, let's not talk about systems, but let's really, really get to systems quickly. This will mean thinking about how do we rapidly improve the quality of roads? How do we rapidly improve the quality of basic infrastructure? How do we also think about communications? In many of these countries, logistics is not just getting the goods to people, it's building trust in the communities so that the people actually want to take the vaccine. So I think that we have answers, and I think that we need to look for those answers in the countries themselves. And we need to say, where possible, whatever we do to distribute these vaccines, can we make sure that we are investing not only in getting vaccines once to these places, but ensuring that they have country systems to keep doing it with the other vaccines that we want them to keep distributing after this fact. And I think this is a great opportunity for that. I think that we already have many opportunities to leverage, but I think there's a lot of work, and I think more than a lot of work, I think that there is a mindset shift that is required to say, it can't just be about delivery. It must be about systems.